Hi everyone, I often get asked to recommend products for buttock acne. So in this video, I will tell you what are the reasons for bumps on the buttock, what can lead to dark spots, what can improve it, what can make it worse, and also how to treat it. So let's get started. So what are the reasons for bumps on your buttock? First, we need to find the cause. The cause can be either folliculitis, wherein there is infection of the hair follicle leading to red bumps and pustules in the buttock area. Then it could be acne. Acne is the infection of the pilosebaceous unit. So there is the hair as well as the gland present next to the hair. That entire area gets inflamed and that leads to acne. It could also be due to keratosis pilaris, wherein there is thickening of the skin around the hair follicle, leading to small, tiny bumps, which is covering the entire buttock. This can also occur on the arms and on the legs. There could also be furuncles in the buttock area. Furuncle is a larger, deeper infection as compared to folliculitis. Folliculitis only affects the hair follicle, whereas a furuncle affects even the tissues surrounding the hair follicle. It could also be due to contact dermatitis. If there is any kind of irritation due to an allergen, that can lead to bumps or dark spots in this area. And it could also be due to hidradenitis suppurativa. Hidradenitis suppurativa is an uncommon condition that affects the buttock area. It can also occur as bumps in the groin and in the axilla. So they appear as bumps which are very painful and heal with scarring. So please consult a dermatologist if you're getting bumps, nodules in this area, and if these areas are getting infected again and again and leading to pus, and if these are painful. We have to rule out hidradenitis suppurativa. It is a difficult condition to treat, but we can definitely make it better. Now let's understand the causes for dark spots on the buttock. So a lot of people have bumps on the buttock, but some people complain only of having dark spots on the buttock. So what could be the causes for that? One could be post-inflammatory hyperpigmentation. That's the most common cause. It can be after acne, when the acne resolves. It can be after the folliculitis, when that resolves, or even due to waxing. If waxing causes any kind of burns in this area or pulls the hair out and breaks the hair under the skin, that can also lead to bumps or folliculitis or even dark spots. If you wear tight fitted clothing, if you wear synthetic fabric which rubs against your buttock skin, and this can lead to irritation, and then sweat tends to accumulate in this area, and that can make things worse and also lead to darkening. Also, if you are scrubbing your buttocks either with a loofah or with any of these brushes or dry brushing, that can also lead to dermatitis in the area and lead to darkening. Wear only pure cotton undergarments. This is very important. Keep the undergarments clean. It has to be washed and ironed every day. Make sure to bathe immediately after finishing your workout. Don't linger on in your workout clothes. That can also lead to irritation in the buttock area and also lead to dark spots and worsening of acne. Avoid very tight fitted clothing or denims. Denim are thick material. They tend to irritate the skin a lot and also tends to accumulate sweat for a long time. And because the fabric is rough, it can irritate the surface of the skin. So try to avoid wearing denims, especially when you have buttock acne or dark spots in your buttock area. Also avoid irritating home remedies. Buttock is the area where you should not experiment with any kind of home remedies. I see people using these masks, these besan scrubs, or even like moong dal scrub, and even baking soda on the buttock area. Please don't use it. Buttock is an area which should be treated with a lot of care, because when you're sitting, you're putting so much of pressure on it. It has so much of friction that it goes through throughout the day, and also sweat can accumulate in the area. So it is a sensitive area. You don't want to irritate it by using all these home remedies, because this is not going to solve the problem. These home remedies are neither going to get rid of dark spots, nor are they going to get rid of acne or the bumps. Okay, so it's always better to get it evaluated and take a proper treatment rather than experimenting, as it can irritate the skin and make things worse. So how to treat it? First, we need to find a cause and address it. If it is folliculitis, why is it occurring again and again? We need to find that. If there is acne, does it involve other body parts, or is it only the buttock area? We need to find that. Is it because of the clothing that you're wearing? Is it the friction that is causing this? So finding the cause and addressing that is very important. But today I'm going to tell you some general measures that you can take if you have bumps on your buttock area. Then we're going to discuss about the dark spots. So if you have bumps on the buttock area, you can use benzoyl peroxide soap. Benzoyl peroxide soaps do help in reducing the bacterial overgrowth in this area and helps in reducing acneiform eruptions. You can use the soap, leave it on for about 2 to 5 minutes, and then you can wash it off with cool water. Avoid using very thick creams or petrolatum in the buttock area because this can occlude the skin and lead to acne. So try to use thin gel based products in this area if you have acne prone skin and if you have buttock acne. You can use glycolic acid based creams in the buttock area. This helps in gently exfoliating the skin and also moisturizes the skin a little bit. Don't overdo it. Start with twice in a week. If you're able to tolerate, then you can use it alternate nights. Glycolic acid based creams do help in reducing both acne and dark spots, so I like to give it for maintenance. You can also use salicylic acid and lactic acid based lotions. This also helps in reducing acne eruptions as well as dark spots left behind by acne. So if you have frank acne, it's better to use a salicylic acid based spray. If you have dark spots, then go for lactic acid or glycolic acid. This way you will get rid of active acne as well as the dark spots left behind by acne. Always moisturize the skin on the buttock area. You can use a light gel-based moisturizer or a moisturizer that contains lactic acid, which helps in gently exfoliating as well as moisturizes the skin. Don't go for very thick creams, but make sure to use a gel-based moisturizer. Applying a thin layer of moisturizer helps in preventing friction. It forms a protective layer between the skin and the garment that you're wearing, so the kind of rub and friction due to the garment is less. So make sure to use a thin gel-based moisturizer. All the product recommendations will be mentioned in the caption below. Now let's discuss about dark spots. If you have dark spots, go for a glycolic acid or a lactic acid based lotion. That can help. You can even use a kojic acid based serum twice in a day. This can also help in lightening dark spots. Remember that skin on the buttock area shows response very slowly. It's not as fast as the changes that you see on your face. Okay, so you have to be very patient with treatment and use it regularly in order to see results. Now I want to discuss about specific conditions. Like if you have folliculitis, then we usually give a course of oral antibiotics depending upon severity. So just using topical medications is not going to help. So I don't want to give this information from the video that, whatever you have on your buttocks, you can just do something at home and it'll go away. No, it depends upon the cause and also the severity. So if you have a lot of bumps, then we give a course of oral antibiotics followed by topical antibiotics, and then that can help in reducing it. If you have acne, this also depends upon the type of acne that you have. If it's severe, we do give a course of oral isotretinoin for a few months and combine that with a salicylic acid based spray or a lotion that can also help in controlling acne. If you have contact dermatitis, then we give a short course of anti-inflammatory medications followed by moisturizers, which can help in reducing the contact dermatitis. If you have hidradenitis suppurativa, then this requires long-term treatment up to 9 months to a year. We give oral antibiotics with other anti-inflammatory agents for about 3 to 6 months, sometimes up to a year. Hidradenitis suppurativa has a large spectrum from mild to severe. In severe cases, we even go for surgery. So if you are suspecting hidradenitis suppurativa in your buttock, in your underarms area, please consult your dermatologist. We can help you and make things better. So there you go, a detailed video on buttock acne and causes of bumps on the buttock as well as dark spots. I hope you found this video useful. If you like such skin and hair related content, you can follow me on my Instagram handle Dr. Achal MD, where I post such skin and hair related content daily. Thank you for watching.